While we're all painfully aware that we're in the midst of a pandemic of the coronavirus, we're in flu season 2. So here to help us understand what we need to know about the flu of 2021, Dr. Casey Lafferty, Medical Director of Health First. Good morning.
Good morning. Thanks for having me. I'm excited to talk about flu season and partner with Genentech on this.
Well, it's an important topic because talk to us a bit about how people can know if they have the flu or the coronavirus when some of the symptoms are quite similar.
Yeah, as you mentioned, the symptoms are quite similar. So as providers, we are definitely encouraging our patients to contact us as soon as they start to develop these symptoms, because we do potentially need to test to diagnose whether or not our patients have COVID-19, flu, or sometimes even both. And those first 48 hours of symptom onset are critical in terms of treating for the flu with antiviral therapy.
So let's talk about over-the-counter medications that we can purchase. What do those actually treat?
So the over-the-counter medications help kind of treat symptoms, but they don't stop the duration of the flu infection itself. So it's really important to talk to your provider within those first 48 hours to get a prescription for antiviral medications to reduce the duration of your flu symptoms. There's some medications like Xofluza or baloxavir marboxil, which is actually a single dose treatment for flu to reduce those duration of symptoms.
Well, what advice do you give us if we find out we've been exposed to someone with the flu? How do we protect ourselves?
So there's definitely ways to protect yourself, and there are medications that are prescriptions that you can get from your provider to help prevent yourself from getting the flu. Recently, in November, Xofluza was actually approved as what we call post-exposure prophylaxis. So you can take this medication if exposed to somebody, and it will help you prevent getting that flu infection itself. It is for people who are 12 years of age or older, and I do tell my patients that there are some symptoms, side effects that are seen in studies that patients did experience that are nausea, headache, sinusitis, bronchitis, and sometimes diarrhea. So I let them know about that.
It's always good to know what the possibility. Can you kind of give us a picture of the flu season now? If people have been wearing masks and social distancing and washing hands, have we seen a reduction in cases of flu?
Yeah, at this moment right now, we are actually seeing low-level activity of the flu virus itself, but that doesn't mean things will change. I mean, they will potentially. The flu virus itself can linger all the way up until May, so we definitely want to be ever vigilant about it. It is a contagious virus, and it can cause serious illness. Patients can be hospitalized with this, and up to 45 million Americans annually can actually get infected with this virus.
Dr. Lafferty, send our viewers to a website where they can get more information.
Yeah, so they can go on cdc.gov/flu if they would like general flu information. They want to know about activity in their area, as well as nationally what's going on with the flu. And for more information on Xofluza itself, you can go onto the website xofluza.com, which is XOFLUZA.com, for information on this single-dose medication to treat and prevent the flu in people 12 years of age and older.
Dr. Casey Lafferty, thank you for being with us.
Thanks so much. Have a great day.
You too. We'll be back with Lifestyles after this. Stay with us. We're